As Lori said, my name is Scott Strong. I'm Executive Director of RISE. I want to thank you for your taking the time today. I know hopping on these meetings throughout the day can be difficult, but of all the things that you do today, this is going to be a really important part of your day, and because it has such a huge impact in our community. These campaigns are really important, and I'm going to talk about the campaign a little bit, but how your investments make a difference in early childhood programs. The amounts that you've given over the past, what I just heard, is really impressive. And when you go back as many years as you've been doing this, it's made a huge impact in our community. So thank you for that. Again, very impressive. So briefly, RISE, we're a nonprofit organization, and we provide a continuum of care from early childhood, family support, and education, and crisis respite for child and adolescents, all the way through child, adolescent, and young adult mental health. We're the result of a merger that occurred in 2017. We were two other organizations, Community Partnerships and Center for Families, that have been operating for over a combined 40 years in our community. I'll be talking in more detail about our early childhood programs, but I want to mention briefly some of our mental health programs, because I know mental health, especially today in the COVID environment, is really important. So RISE provides a variety of community-based mental health programming, which ranges from in-home therapeutic intervention all the way through care management and case management services. Our primary work is to support children and young adults at home and in the community. And most of the children and young adults that we work with are at high risk of being placed in a psychiatric hospital, residential treatment center, or corrections. Typically based on some disruptive behaviors that they're experiencing at home or in the community. It could be self-harm, it could be anxiety, depression, a variety of things that are dysregulating the individual and putting them at risk of a placement in an institution. So that's the primary function of what we do in the mental health space. And again, as I mentioned, today, given the environment we're in, we're seeing an increased need for our mental health services, because people are really struggling without that connection. And being connected to their at home, at school, in the community as they were before. So I would like to highlight two of our early childhood programs for you today: our Welcome Baby and Beyond program and our Parent Child Plus. I should mention that as of March, all of our programs have gone virtual. And although that was, it's a change from what we were doing, it's been pretty successful. We've been finding that people have been pretty well engaged in their mental health treatment and also their early childhood work. So briefly, Welcome Baby. The goal of the Welcome Baby and Beyond program, it's an early childhood home visiting program. The goal is to develop the parent-child interaction. So many of the children and families we work with have a history of trauma. Oftentimes these are young parents, and we're helping to work on healthy attachment and bonding early on in the child's development, which happens right at birth. Oftentimes even in utero, we're helping the parent and the mother really connect with their child and learn more about what is going to be helpful to them when the child comes to the world. This program is open to any parent or caregiver in Dane County who is pregnant or has children ages 0 to 5 years old. We support the parents and caregivers around family well-being, age-appropriate child development, connection, and referral to community resources. Many of the families that we work with, there's high levels of anxiety and depression, some postpartum depression with some of the moms that we're working with. And so it's really important that we connect them to the services in the community so they can get really comprehensive, holistic care for themselves and for their family. The families that we work with generally have high-risk indicators that qualify them for our program. It could be low income, educational barriers that they've experienced themselves, could be mental illness, as I mentioned, housing insecurity, trauma, violence, substance abuse. English as a second language is common among the families we serve, and then could be a history of child abuse and neglect. and nearly 90% of our families experience 2 or more of these high risk factors. And so we're working with some of the families who are at the highest risk in the community, and getting children off to a healthy start is extremely important. It helps them get a jump start on their education and well-being. So hopefully they won't come into some of our other programs later on that we offer because they've gotten the supports that they needed early on. And a big thing that we try to do is interrupt the patterns of trauma and violence in the home. I also want to talk a little bit more in detail about our early childhood and education and literacy programs, our program. Before I do that, I just want to mention a couple statistics. About 19% or 5,000 children under the age of 5 years old in Dane County are living in poverty. So 20% of children under age 5 are living in poverty in Dane County. I imagine that could be increasing just kind of given the environment that we're currently in. So this matters. Children living in poverty face multiple challenges in their own development. By kindergarten, children from middle-income families are read to approximately 1,000 hours compared to 25 hours for children from low-income families. That's a huge disparity. Children from literacy poor homes arrive at school with vocabularies of 800 to 1,000 words. Compare that to 6,000 to 10,000 words for children from literacy rich homes. Again, we're seeing more disparities at such an early age with these children. By the time they start kindergarten, children living in poverty have heard, now this is a big number, they've heard 30 million fewer words. That's 30 million fewer words than children from literacy rich homes. Now that's not 30 million different words. It's children that are engaged in parents having conversations, having friends that come in. So they're part of everyday conversational experiences. And so children who are within literacy rich homes are hearing many words, and they're hearing different contexts for words. Whereas if a child who's in a literacy poor home, generally in poverty, in a poverty situation, they're not having that same access to continued conversation and exposure. So 30 million it seems like a lot, but that's a huge disparity for children when they're hearing that many fewer words. So they're getting off to a really poor start to start kindergarten. So as we know, gaps and disparities exist before children enter school, and they're entering behind children, and it's really hard to catch up. So what we try to do with our early childhood program, so we've got a Parent Child Plus program, which is designed to address these disparities. Our Parent Child Plus program is a national home visiting program that's been around for over 50 years. It began in New York, and it's throughout the country. It serves children ages 2 to 4 years old. Families that come into the Parent Child Plus program are living at or below 150% of the poverty level. The program empowers parents to become their child's first teacher. So what we really want to do is help the parent be the first teacher to their children. And many of the parents that we're working with, as you heard earlier, may not have had positive educational experiences themselves. And so we're helping the parents, not only helping the child with their literacy, we're helping the parents with their literacy, building their competency, their comfort level, and they're becoming the child's first teacher. So they can continue reading to and playing with a child after we're no longer involved. Our home visitors go in there twice a week for 30 minutes. Right now we're doing this virtually. We set up YouTube videos and different things to make sure that we are connecting with families. We do some family observation and model positive ways that parents can play and read to their children. Again, building the language and literacy skills early on. There's national research that has validated this program's model. We know that a randomized control group of the Parent Child Plus program found that low-income children who completed 2 years of this program went on to graduate from high school at the rate of middle-class children nationally. So we know that there's long-term impact of getting children helping them with literacy early on. Our local outcomes, for those of you who like to hear outcomes, we serve up to 170 families from low-income households annually. 85 to 90% of the children who graduate, and we do have a graduation every spring for these children. It's the cutest thing you want to see with their little hats and gowns, and parents are so proud of them. And we do this at the Children's Museum once we're not in the COVID era. But 80 to 90% of those children who go through our program are kindergarten ready. So they're actually at grade level along their peers. They've improved their language and social emotional skills. Parents increase positive behaviors and contribute to the child's success in school. So we know that by strengthening the parents' abilities to support their children's education and development, their expectations of their child's education has significant and long-lasting results on academic success. Again, some of the parents that we've worked with have not had their own academic success, and by us helping build them up, they are supporting their children and they're advocating for their children in the schools. Once in school, children who have gone through this program have fewer behavior incidences and better attendance in kindergarten. And we know that attendance and staying on task really helps with academic success. So we've had some really good success with this program. Parents are highly engaged with us as we're working with them. We continue to provide the program virtually to the best we can. Every week we bring in an educational book and toy, and we're dropping those off at the parent's house. And then again, we're using videos to engage them with that book and that toy and helping them become their child's first teacher. So as you can see, your support and the support of your teams make a huge difference. The money that you've invested so far through the years is really helping children get off to an early start, helping parents build their confidence levels, and helping to kind of sustain and maintain children's literacy throughout their educational career. So now more than ever during COVID, we are seeing an increased need for investment in our community. And so I just want to encourage you and thank you for what you are going to do with your teams, and just advocate for continued investment during this time in our community and the programs that make a difference. So again, thank you for all of your time today. Thank you for hopping on another virtual call. And I encourage you to do what you can to engage your teams in the campaign. So thank you. I'm happy to take any questions if there's time.
We do have a few minutes yet if somebody'd like to just unmute themselves and ask a question. I actually have a question.
Yes, Laura.
So how do folks get referred to you? How do they find out about you? Are they through social service agencies or school psychology, early childhood psychologists, or how do folks find out about you and get referred on to your program?
Great questions. It depends on our program, but all of our programs are voluntary. So nothing is court ordered, which is great because sometimes programs are court ordered. So these are all voluntary programs. So with our Parent Child Plus program, we put up flyers in libraries, in medical clinics, in churches, in schools, wherever. So parents are hearing about our program. So we do some active recruitment for that. But we get a lot for our early childhood programs. We get referrals from pediatrics or pediatricians, from nurses, from the hospitals. When a child is born, we're getting referrals. And then the neatest thing is we get a lot of parents who've gone through our programs referring their neighbors, their friends, and say, this was really helpful to me. I think you should give them a call. They might be really helpful to you. So that's the biggest compliment, is when we get parents referring parents. And the other cool thing is we've actually, in our Parent Child Plus program, we've had parents who've gone through our program who are now our employees, providing service to these children and families. And so we get referrals from everywhere.